Hi everyone, it's Helen here, and today I want to talk to you a little bit about helping preschoolers with anxiety. Now, it's normal for kids to feel worried or upset from time to time, just like we adults do. And so that's just a normal part of the human condition, but we want to keep it in check. We don't want to let anxiety and worry become the dominant feeling that our children are feeling or that we're feeling. So today we're going to talk a little bit about why anxiety happens and what we can do, especially in this time when preschoolers might be looking at going back to school after having a break at home and things like that. So anxiety is, as I said, a normal thing. It can make us as parents feel quite anxious because it's hard to see our own children struggle, right? So we need to also think about our own emotions and what we're modeling and showing children and the language that we're using around children. But we'll go into that a little bit later. So first of all, you will probably know that anxiety appears sometimes physically through tummy aches or headaches. It might be children feeling restless or fidgety or not wanting to eat. So those are kind of physical symptoms that you might see. Emotionally, they might be very clingy or irritable. They might seem agitated for no particular reason. They could be afraid of making a mistake, so afraid of trying something new, and maybe have increased crying. So look out for any of those symptoms in your child. And then behaviorally, they might be avoiding things, like they might not want to go to summer camp, or they might not want to go to play with a certain friend. They may just become very shy or not want to go back into the school, into the classroom. So those are kind of things to look out for. In this video, we're talking about, mild cases of anxiety. It becomes very severe, that it's really disrupting your day-to-day life and your child's day-to-day life, and they're losing out on many opportunities and things. Then it's time to get professional help from a therapist. But you can try these ideas at home first to see if they make a difference in your child's life. So first of all, it's not something that we can instantly fix when a child is anxious. So we need to kind of take it slow, take it step by step. And as I talked about before, we want to make sure that we're not projecting that anxiety onto our child. So it can really be a full circle. So the child feels anxious, then the parent feels anxious, that the child's anxious, and they don't know how to fix it, and that makes the child more anxious. So we really want to use our own mindfulness and breath work and emotional management to ensure that we are calm and secure in our feelings, and we're not pushing any of that onto our child. And then validating what the child is feeling. So very often I see and hear parents with the best intentions, but they accidentally, I think, minimize the child's emotions by not validating it, but by kind of dismissing it. So for example, a young child may be scared there's a monster under the bed, and the parent says, "No, don't be silly, there's no monsters, monsters don't exist." Or the child is crying because they've lost a toy or something, and the parent says, "Okay, don't be sad, we're going to get you a new one." All that is done with the best intention, but what it actually does is tell the child that it's not okay to feel that way, or that their thoughts are silly or not appreciated. And we don't want children to stop communicating with us and sharing what they're thinking and feeling. So we want to validate emotions. So If your child says, you know, I'm scared because there's a monster under my bed, you might say, oh, I know what it feels like to be scared. That's pretty hard, isn't it? I know you're feeling scared because you think there's a monster under your bed. And then we go into the strategies, like, and maybe talk about, why do you think there's a monster under your bed? And could it be that your imagination created it? And children have very vivid, really great imaginations, and they can create all kinds of things with that. So we want to celebrate, you know, how creative they are, that they can use their imagination, but also empower them to use their imagination to stop fearful or anxiety provoking thoughts as well. So that's one thing that you can do. Just talking it through them, so talking through it with them, so getting them to really express what it is that they're thinking and feeling. That's sometimes a bit hard with preschoolers because they may not have the language to do that. Using drawings is a great way to get children to express what they're feeling, and then you could scribe the words with them, ask them questions about their picture and things, and try to get down to the kind of root cause of what they're feeling and why they do feel so anxious. As I mentioned, we have all these neurons in our body that can reflect, and children are just so great, I'm sure you know, at picking up how we're feeling, what's going through our mind, even if we think that they don't. So just think about it with other adults. There's certain people, you walk in the room and you just want to be around them. They're positive and they have a certain energy. And then there's other people who you avoid because you don't want to be in that emotional space. So that's the same thing, like picking up these emotions. So if you, you know, show up that you're feeling nervous or anxious, it's quite difficult for a child not to pick that up. Of course, we all do feel nervous and anxious sometimes. So when we do, what I like to do is say, like, oh dear, like I'm feeling a bit anxious right now, so I'm going to take some breaths and just make myself a cup of tea and have a little bit of calm time. So you're modeling how you solve the problem of anxiety that you're facing. But we don't want to, you know, push those kind of big anxious thoughts onto children every day. So just be mindful, model that it's normal to feel anxiety and that you too have to think about what strategies you're going to use, but then also, you know, don't just unconsciously or subconsciously start showing children all the anxiety that you face in everyday life. Now, just before we finish today, I just wanted to give you another little tip about children going back to school. So they might be a little bit fearful because they've been home for several months, and now some children are going back and some children might not be. Some friends might not be there because some places are doing half online and half in the class, and there's all kinds of situations. And your child may be going back to school and it's a very different looking environment where adults are wearing masks, children might be wearing masks or might not be, but children might be not in the groupings that they used to be in. I'm sure teachers and administrators are trying their best to make this as smooth as possible for our young children, but it's definitely going to be a little bit different, and that might itself cause some anxiety in your child. So just be ready to listen, to talk to them about it. If they don't want to go back to school and are getting clingy and things, you might drive by the school and just say like, hey, there's your school, and soon we're going to be going back to school, and your teachers inside, shall we wave to them and say hello? And then just using language and drawings and stories to really talk about how your child's feeling, and then what they could do to feel more comfortable about going back to school, or perhaps remembering how happy they were when they were in school before. And this time it might be a bit different, but they're still going to have lots of happy memories in there. And you can't wait for them to tell you about what they did at school and what are they looking forward to doing at school, and those type of things. So I hope that helps with just a few tips about anxiety and preschoolers. Thank you.